Welcome everybody to this webinar. We will be starting in the next 1 minute. So welcome everybody to our Tuesday evening psychological and psychiatric webinars. These webinars are brought to you courtesy of the professional associations, Kenya Medical Association, Kenya Medical Pharmacists, Kenya Medical Practitioners, Pharmacists and Dentists Union, CPAC, the laboratory people, the Pharmaceutical Society of Kenya, Pharmaceutical Association of Kenya, Kenya Clinical Association, and today we have the pleasure of the representative from the National Nurses Association of Kenya, Simon Derito Githui. Simon Derito Githui today will be speaking to us about vaccination against COVID-19 among healthcare workers, the acceptability of it. There has been a lot of unsureness about COVID vaccination. Will people take? Will people not take? And today we want to see what the acceptability is in Kenya and across the world. Simon Derito Githui, as I said, is a member of the National Nurses Association of Kenya. He is a lecturer in mental health and psychiatric nursing at the Dedan Kimathi University of Technology in Kenya. He is currently the chair of Department Nursing Education, Leadership, Management, and Research. He is also involved in community psychiatric nursing with a focus on rehabilitation of long-term mentally unwell patients and case management. His research interests are primary research focus, which is on intimate partner violence that impacts on survivors' health, neurocognitive disorders, and nursing education. He is married with 2 children, and he enjoys traveling, reading, and most important, shopping, which I'm sure his partner would love. Ladies and gentlemen, welcome Simon Derito Githui to today's webinar. Simon, welcome.
Thank you so much. My namesake, Dr. Simon. Greetings, everyone. Good evening. I hope you're well. I want to welcome you to our today's presentation. Allow me to stop sharing my video so that I can be able to share my screen and we can follow using the slides. Thank you. Just give me a minute. Thank you. Dr. Simon, please confirm that the slides are visible on your side.
Put on slide show, put Thank you. That is fantastic.
Okay, thank you so much. Want to appreciate Dr. Simon for that introduction. Yes, for sure, today we are looking at acceptability and hesitance of vaccination against COVID-19 among healthcare workers. And like all of us are aware, to help control the spread and effects of coronavirus disease pandemic, undivided efforts have been made to develop vaccines against this disease. Of course, this is in addition to what we are already doing to try and manage this particular disease. Measures like wearing masks, hand washing, and others. And it is acceptable that vaccine is an effective approach to prevent infection and reduce mortality of many infectious diseases. And that is why we can't run away from the vaccine if we are to bring COVID-19 disease under control. Already, as we are already aware, there are several vaccines that have been developed and approved for use. I'm sure some of you are aware of these vaccines to include Pfizer, Moderna, AstraZeneca, among others. There are quite a number of them that have already been developed, tested, and approved, and they are safe for use. Several countries already have commenced vaccinating their population with priority given to healthcare workers. Others, like our country, we are just about to roll out the vaccination, and we hope that we should be able to start vaccinating people against COVID-19 very soon. However, even as the rolling of vaccination commence, vaccine uptake is a concern that has taken center stage in the recent past. And it's important for us to appreciate that vaccine hesitancy poses real and existential threats to the prevention and control of vaccine preventable diseases. And if then we end up having vaccine hesitancy, this will hinder our efforts to mitigate COVID-19. We might not be able to continue taking care of this disease effectively. And so we should be able, therefore, as healthcare workers, be concerned about acceptability and hesitancy of this particular vaccine. Now, vaccine hesitancy prevents a barrier to immunization program success. And in fact, it has been identified by WHO as one of the top 10 global health threats in 2019. And I want to say here today that availability of any vaccine does not necessarily translate to its adoption. So for sure, the government could be working very hard to bring the vaccination to us. They could be planning to roll it, like we already know, in different phases. And the fact that we will have the vaccine in the country, that does not translate to adoption. So we might want to be concerned about acceptability, okay, of this particular vaccine, and probably take care of any hesitancy that might be there. What does history tell us about acceptability and hesitancy of vaccine uptake? We take a case of Nigeria. In 2003-2004, the northern part of Nigeria, people boycotted polio vaccine. And this resulted from perception of religious leaders. Okay, they had wrong perception about the vaccine. They did not trust the process. And because of that, then they influenced the people who are living in this part of the country negatively. Okay, and because of that, people boycotted and did not take up the vaccine. What was the result of that? Okay, this resulted to a 5-fold increase in the polio incidence in Nigeria in general. And actually, the surge of polio outbreaks not only affected Nigeria, it spread to neighboring countries and even to other non-African continents. So we cannot be able to wish away, okay, issues to do with vaccine hesitancy. We need to be aware about it, and we need to decide as a country how we're going to deal with it. But the question, therefore, would be, why would we be concerned about acceptability and hesitance of vaccination against COVID-19 among healthcare workers? Why should that be a concern of anybody interested with success of rolling out this vaccine in the country? It is important for us to appreciate, that as healthcare workers, we act as ambassadors for evidence-based medical intervention. So any medical intervention that is to be rolled out and to be rolled out and for use by the population, then we are key stakeholders into it. And the healthcare workers are considered to be the most trusted source of vaccine-related information for both the patients and even the public. Okay, so people believe what we say, how we say it, and what we communicate to our patients and also to the public. And healthcare workers are in the best position to, one, understand hesitancy among patients, to respond to the safety concerns among their patients and even the general population. And also they're in a good position, okay, to find ways of explaining them the substantial benefit of vaccination. And so if we are to achieve success in rolling out the COVID-19 vaccine in our country, then we cannot neglect, or we cannot run away from bringing healthcare workers on board if we are to succeed. And it's also important to appreciate that the initial uptake of vaccine by healthcare workers is critical for safety, health system functioning, and even for public opinion. And acceptability of vaccination by healthcare workers is a major factor that is consistently associated with the patient and population uptake of the vaccine, adherence of vaccination schedules, and even patient population reduced hesitation. A case would be a case of Britain, where we are told that when they rolled out the vaccination, many people took the first dose of the vaccine. We know most of these vaccines, if not all of them, somebody needs to take at least 2 doses. So we had a good number of people coming for the first schedule of vaccination, but they never came for the next schedule. Probably, I don't know, we should be able to find out. This is that probably the adherence to that vaccination schedule depended on healthcare workers. And so for people to take up the vaccine, for the population, the general population to take up the vaccine, for them to adhere to the vaccination schedules, for them, for us to reduce hesitation among the population, among, in this case, among Kenyans, then we need to be able to involve key stakeholders in this, and these are healthcare workers in the country. But when you look at the situations, healthcare workers taking up the vaccine, what is the prevalence of acceptability and uptake of this vaccine? Okay, I must say that I don't have data for our country among healthcare workers, but I'm aware that there has been some little study on the population, on the general population, and I think the acceptability has been around 16%. But let's learn from other countries. In France, we 76.9% of healthcare workers reported as willing to take the vaccine. In Malta, 52% of healthcare workers said that they were likely to take up the vaccine. In the US, that 6% of healthcare workers were willing to take the vaccine, and 56% of healthcare workers in the US were not sure or would wait and see and review data before they would accept to take up the vaccine. In Saudi Arabia, 49.71% of healthcare workers were willing to be vaccinated as soon as possible once the vaccine would become available. And in that same country, 50.28% of healthcare workers would delay the vaccination until the vaccine safety was confirmed. So they were quite worried about how safe the vaccine was. In Congo, near home, 27.7% healthcare workers reported as willing to take up the vaccine. The question I want to ask us this evening is, okay, if you were to be offered COVID-19 vaccine today, would you take it up? Would you take it up? If you were to be offered the COVID-19 vaccine today, would you take it up? And I want to ask our technical team to upload that poll for all of us to be able to participate in the poll. Thank you so much. I think the poll is already on our walls. Please take part in that particular poll.
Yeah, the poll is up. If you are offered COVID-19 vaccine today, would you take it up? Let's have people clicking on the poll answer. And I think the poll is also at the bottom of your screen, you just click on the polling tab and answer.
Okay, thank you, Dr. Simon, for that. Okay, now
give them 1 more minute. Give them
okay,
one more minute.
Okay, I will do that. Let me know when I can proceed.
All right. In that 30 seconds, I think you will proceed. "20 seconds to the end of the poll." Peter, people are able to poll?
Yes, Doc. People are able to poll.
Okay, get on some. Are they able to click on, where do they click? For those who may not know.
Zoom screens. I got 62% have voted already.
Okay, give them 20 more seconds. That's a good uptick.
I'm at 65%.
When it reaches 70, I think we can continue the presentation.
70%.
So we are on the
poll. Yeah.
All right. Thank you very much. That should be representative. Thank you very much. Continue, Simon.
Okay. Thank you. I don't know why I can't move my slides from my side. Okay. Peter, are you able to help me?
So when I stop sharing the results, you'll be able to move.
Okay.
Yeah. Okay, try now.
Not yet.
Stop
Peter, the
share.
poll is remove it.
Yeah, I've removed it. I've ended the poll.
Okay, I don't know why I can't still move.
Stop
Peter, I will
share.
request.
Stop
I stop sharing, then I share again.
Yeah.
Okay. Okay, thank you so much. Okay, thank you for participating in the poll. Let's continue. What are some of the factors that are associated with acceptability of vaccination among vaccination against COVID-19 among healthcare workers? Okay, so studies has shown that acceptability of vaccines against COVID-19 was higher among participants. This is among healthcare workers. It was higher among participants or healthcare workers who had positive perception on the safety of the vaccine. Okay. Health workers also who considered vaccination information as reliable and credible were more likely to take up the vaccine. And those who are worried of getting infected with COVID-19 were also more likely to take up the vaccine. Also, those who believe that vaccine should be compulsory for all citizens, okay, also were more likely to actually take up the vaccine. And those who indicated that they were infected with COVID-19 in the past were also more likely to actually take the vaccine. Okay. Sorry, I'm not able to move the slides again. I don't know what has happened. Peter?
thinking now it's from your end. Let me try sharing from my end.
Please share from your end, kindly.
Yeah.
So Simon, stop sharing.
Sure.
Oh, yeah. Oh. Then Peter, share. As Peter starts sharing, and maybe Simon, you'd be interested in the poll results.
Sure.
Yeah. Then the yes, we would take the COVID vaccine if it came today was 51%.
Okay.
Then no, 21%.
Okay.
And not sure, 33%, which I think is in keeping with what you had shared earlier as results from the rest of the world.
Thank you so much, Doc, for that.
Yeah, so we can say we have Kenyan data.
Sawa. Okay, thank you. Let's go to factors that are associated with hesitancy. And go to the next. Oh, thank you. Okay. Now, what are some of the factors that were associated with hesitancy or vaccination against COVID-19 disease among healthcare workers? So those who had hesitancy or reluctant to take up the vaccine were healthcare workers who reported knowledge gaps, who had poor attitude regarding vaccinations, who were concerned about the safety of the vaccine, who perceive themselves to having low risk of getting infected with COVID-19, and those who had difficulties accessing vaccination. Let's go to the next slide. Okay, and also hesitancy was also attributed to concerns of effectiveness, concerns of rapid in terms of development and approval of the vaccine, and also those who did not take up the vaccines had fear of vaccines side effects, and they were also concerned, or they lacked confidence in their scientific vetting process for the COVID-19 vaccines. Okay, let's go on. Okay, and the others viewed the vaccine as a political tool, while others didn't have trust on the pharmaceutical industry to actually develop and supply the vaccine. And those who had previously refused to take other vaccination also had a higher chance of hesitancy to take up the vaccine against COVID-19. And the source of information was also associated with hesitancy to taking up the vaccine. So those who obtained information from social media, blogs demonstrated low prevalence of COVID-19 vaccination acceptance. Let's move on. Okay, we'll stick here for a little bit, and then the question therefore is, how do we enhance acceptability of COVID-19 vaccine? And we will be guided by the Combi model of behavior. This is a model that informs us on how people take up a behavior. The behavior in this case is vaccination behavior. And this particular model, the Combi model of behavior change, is widely used to identify what needs to change in order for a behavior change intervention to be effective. So for example, in this case, for nurses, we are not nurses, but healthcare workers. For example, now we are seeing that 51% of those in attendance today will not will take up the vaccine, and 21 will not take up the vaccine. Okay, so the question is, how can we be able to move those who are not sure and those who are not ready to take up the vaccine? How do we change their behavior so that they can be able to accept vaccination? So this model tells us that for any behavior change, okay, we need to identify what needs to change in order for a behavior change intervention to be effective. This model identifies 3 factors that need to be present for any behavior to occur. Okay? And these factors include capability, opportunity, and motivation. These factors, that is capability, opportunity, and motivation, interact to generate behavior that in turn influences these components. What is capability? Capability is the individual psychological and physical capacity to engage in the activity concerned. In this case, for example, would be vaccination behavior. It includes having the necessary knowledge and skills, okay, on the respective behavior that needs to change. Motivation is defined as all processes that energize and direct behavior, not just goals and consciousness decision making. It includes habitual processes, emotional responding, as well as analytical decision making. Opportunity include all factors that lie outside the individual that make the behavior possible or prompt it. Okay, so opportunities and capability influence motivation, then motivation tends now to guide, okay, behavior change. And then when you look at this model, there are single-headed and double-headed arrows, and they represent the potential influence between components in the system. That means that opportunity is influencing motivation, capability is influencing motivation, but also capability and opportunity also influence behavior, and behavior as well influence capability, opportunity, and even motivation. If you look at if you look at those arrows and appreciate how the direction they are taking. Okay, so both capability and opportunity will often influence a person's motivation to enact a behavior. The greater the capability and opportunity, the more likely a behavior change. Okay, and this will be secondary to motivation. That is, the more capable we are or believe we are, okay, in enacting a behavior, and the more conducive the environment is to enacting it, the more we tend to want to do it. So enacting a behavior feeds back to all the 3 factors, that is capability, opportunity, and motivation. Okay, and the feedback could be positive or the feedback could be negative. Let's take an example. When engaging in a behavior such as learning to drive that requires a skill, practicing the behavior will improve capability that will increase motivation to engage in that particular behavior. By contrast, when engaging in behaviors that meet homeostatic drive, such as eating, engaging in the behavior will reduce the drive to engage in that particular behavior. So the behavior could have both positive and negative feedback, can have both positive and negative feedback, and that can actually influence our capacities and even our opportunities as well. So if we come home to vaccination behavior, therefore, when we think about capacity, okay, then we are talking about abilities, knowledge, skills, and even willpower of healthcare workers. When we think about opportunities, that is concerning the behavior we're interested with today, and that is vaccination behavior, then we are talking about accessibility, availability, regulation, social norms and values, spiritual beliefs, availability of information, and even appeal. Okay, and then therefore the capacity and the opportunity then influences our motivation to actually taking up the behavior. And a motivated healthcare worker is a worker who will have the right positive attitude, positive perception, confidence, trust about the process, and that will then influence their taking up the behavior. Therefore, when you think about the acceptability or even hesitancy of taking up the COVID-19 vaccine among healthcare workers, then you can be able to appreciate that using this particular model. And so if we are to improve acceptability of this vaccine among healthcare workers, then we can be able to play around with the capabilities of healthcare workers, the opportunities that we need to create the right opportunities. And these two will motivate our healthcare workers to actually take up the behavior. And therefore, I might want to invite the National COVID-19 Vaccine Deployment Task Force to be able to look probably at this model and maybe any other model that we can be able to pilot, even in our country, to see whether we can be able to push the percentage of the prevalence of those who are likely to take up the vaccine in the country, as we have seen in our polls. Thank you, Peter. Let's move to the next slide. Okay, so in summary, therefore, recommendation of a vaccine to patients and the general population by healthcare workers is dependent on two major things. One, knowledge about the vaccine and the attitude they have towards that particular vaccine. And literature shows that healthcare workers who have an unfavorable attitude towards vaccination and aversion or hesitation towards vaccination transmit this hostile attitude to vaccination to patients and tend to recommend vaccination less frequently. Okay, let's move on to the next slide. Okay, and therefore going forward, before we roll out the vaccination against COVID-19 in Kenya and probably in a country, I would say, okay, we need to study healthcare workers' willingness to accept COVID vaccine. I think we have already done that with the members who have attended our webinar today. Then we also need to study healthcare workers' willingness to recommend the vaccine to their patients and even their clients and even the general population, because we'll say that healthcare workers are key when it comes to success in the population taking up the vaccine. And we also need to explore determinants or factors of vaccine acceptance and even hesitancy among healthcare workers and address them early, okay, before we can be able to roll out the vaccine. And also we need to promote extensive participation of all stakeholders. And I've just listed a few here. There are so many stakeholders who are involved. There could be professional bodies and association, faith-based organization, private sector, etc., etc. And I think I have my chairman from NNK, the chairman of NNK in our panelist, and I think he can give us a perspective of whether there have been enough involvement of professional bodies when it comes to rolling out of COVID-19 vaccine in our country. Then we need to carry out sensitization about the vaccine and also correct missing information. And when you look at the mandate of the National COVID-19 Vaccine Deployment Task, they have many mandates, but one of their mandates is training and capacity building, and also advocacy and communication, and also social mobilization. And in my own view, okay, before we can roll out this particular vaccine into our population, okay, then probably we need to, or they need to invest a lot on training, capacity building among healthcare workers, advocacy among healthcare workers, proper communication channel, and even social mobilization, both within the healthcare workers family or fraternity, and even in the general population. Thank you very much. I now hand over this webinar to our moderator. Asanteni sana.
Thank you very much. Thank you very much, Simon, for that. And I think that talk has been extremely useful. And maybe I would want to start with your latest point that involvement of healthcare workers in vaccine hesitancy by provision of these training to professional associations may just be one of the most important statements that you have made. With us today, in our panel, we have the president of the National Nurses Association of Kenya. And before I move to the questions, I would want him to make a statement on involvement of the nursing team, who form the highest number of cadre, and they are probably the ones who will be giving the vaccination. One statement that is devoid of politics. Obengo.
Thank you, my good brother, Dr. Kingondu, Bwana Katibu. And I like the last statement, devoid of politics. You can hear me?
Loud and clear.
Yes, yes, we can.
Yeah, so it's very simple and clear, and this is nothing political. Vaccination, the COVID vaccine initiative is a global phenomenon, and it's something that is ongoing globally. As National Nurse Association of Kenya, we have our regional and more or less continental network, plus the global network through ICN. that we exchange notes as leaders of nurses globally. And actually, the vaccine initiative has been one of the topics that we've been discussing with other global leaders within the health sector. The rollout of vaccine in Kenya is nothing new, and it's something that also is being done globally. But there are always processes and the how of how any initiative is supposed to be done. Unfortunately and sadly, in Kenya, the health workforce hasn't been involved, hasn't been engaged. We've been kept in the dark insofar as the planning of the rollout is concerned. So our strong message to the government, and having I've listened to the presentation from Simon, insofar as the statistics and the data of who are supporting, who are not sure, who are saying that probably they will not go for the vaccine, it's a demonstration that we need a lot of sensitization, a lot of information to actually bring ourselves in the same platform insofar as information is concerned. And our issue is not just actually opposing or supporting the vaccine initiative, but rather ensuring that actually it adds value and it meets objectives. So as of now, we will, in terms of acceptability, it will still depend on at what level we're going to be engaged. And Dr. Kingondu, you know very well that I mean, vaccines are given by the nurses. I mean, let's say 90% of the vaccinations activities done by the nurses. So it's actually perhaps us that as the people who are going to give the vaccine, we are still not yet been actually sensitized on the same. So that is a message that we want to send out very strongly. And for us, we will wish to have 100% acceptance, because if it's something that's gonna benefit us, then it should be accepted by all of us. But it also still related to when we see the first patient or the first client was pronounced with COVID-19. You could see doctors, nurses, clinical officer were taking off when the clients are coming to their probably clinical areas while having symptoms of COVID-19. The way, I mean, the tool we use to defeat that, Dr. Kingondu can attest to that, is we did a lot of training, a lot of sensitization, and that's why we defeated that fear in terms of case management of COVID-19. The same thing should happen to the vaccine initiative. The only way we can defeat the fear towards the vaccine initiative is to educate and train and sensitize our health workers, because internationally and globally, they have been the first recipients of the same. Thank you.
Thank you very much, Obengo, and I am sure your team will be involved by the national team. I don't think anyone can do without you. Our champion in vaccination at the Kenya Medical Association is Dr. Joy Mugambi. She's involved at international level, even on COVID vaccination, and she has a interest in that. I would like her to make a statement before we move to the question and give us her view on the COVID vaccination as it is almost beginning. Dr. Joy Mugambi.
Thank you very much, Dr. Kigondu, and thank you very much, Simon, for highlighting all about vaccine hesitance. It's a big challenge, but we truly appreciate the fact that we get the opportunity to get the COVID vaccine. I'm Dr. Joy Mugambi. I'm a family physician. I'm as well a leader within Kenya Medical Association, and also leading the family physicians within Kenya and Africa. We've got a lot we are doing in terms of encouraging people to take up the vaccine. I've had the data from today's poll. It's something that's global, but we hope that these challenges can be mitigated by the information that Simon has shared. We're also having another sensitization forum during the AMREF Health conference, which is coming up in next week. And on 8th, we have a session for vaccine hesitants. I urge you guys, all of you within the Kenya Fora, do register. We have very great speakers from all over the world and who will also be sharing more about vaccine hesitants. Thank you very much, Kigondu, for this. And we hope that when the vaccine is rolled out, we do get to partake in terms of service provision and also have our members trained, just as Ombengo has said. As much as we are rolling out, nothing much has come to the ground to the primary healthcare providers, the space that we offer our services in as family physicians. And we do hope that this is something that will trickle down as the nurses also are being trained, all other providers, in order for us to ensure that vaccine hesitance is not encountered and we end up having better vaccination coverage and better service. Thank you, Kigondo.
Thank you very much. And now I'll go straight to the questions. And Robinson Duarte happens to be my boss somewhere. He is asking, will NHIF cover COVID vaccine related complications? Simon, do you want to take that?
Allow me to leave that to Dr. Joy Mugambi, if you don't mind.
Sorry, Dr. Kigondo, just repeat the question.
Will NHIF cover COVID vaccine-related complications?
And unfortunately, this is where we are at in terms of information of how the rollout will go, how it will be financed, what NHIF will take care of, or what even your insurance cover will take care of once the complications do occur. But we do hope that they will treat each and everyone just like they would treat anyone who has any illness without any bias when it comes to treatment. But we don't have much info in terms of the complications, but these are things that we require to engage in.
Dr. Simon, maybe I could just chime in a bit about that.
Thank you.
My apologies are coming late. We were actually in a meeting that mainly concerns the COVID-19 vaccines. And a question like that was raised. In fact, somebody had asked now who will take the fall if, for example, the extreme of this happens, for example, a death happens. So there's an agreement because we're getting AstraZeneca, the vaccine from AstraZeneca. So there's an agreement between AstraZeneca and the government in terms of indemnifying the company and how to deal with now the adverse effects that will come up. So there is a fund that has been set aside in which the people who will get these adverse effects from immunization are able to, they can channel their complaints through that and be able to be taken care of. That's the little I can say. It's something I've heard from the forum we were in, but we can feel free to ask further and interrogate. I'm sure we will get answers, and especially with the National Vaccines and Immunization Program. I wish we had someone with us here, but yeah, that's in terms of that. There's a special fund that has been set aside to help deal with the people that will be affected adversely.
Thank you very much. I think the Kenya Medical Association are part of the COVID, National COVID Committee, and that question can be asked this Friday. Again, Robinson Duarte asks, will the compensation provide for severe complications such as blindness secondary to getting the vaccine? I think that is what Dr. Josephine Ohas has said, and we will follow up with the government on that. Then Peter Wandera asks, what is the efficacy of this COVID-19 vaccine? The vaccine was developed based on the virus strain in Europe and not on the strain in Africa. Who would want to take that?
I can answer that. The efficacy is 63%, specifically for the AstraZeneca one. 63%.
Okay. Wilson Moriah asks, what do you think would be the impact of vaccination against COVID-19 to the preventive measures, such as use of masks, social distancing, hand washing, and the rest, especially to the general population?
I can take that, Dr. Kigondu.
Yes,
I think it's important for us to emphasize the fact that the vaccine is not the silver bullet to management of COVID-19. I think we will have the vaccine rolled out and we expect the population will take up the vaccine, but we will still continue with other measures of managing COVID-19.
Okay. Karima Dawobai is asking, why have pharmacists been left out of something which they should be at the focal point of? Honestly, policy frameworks are wanting. Pharmacists being left out is unbelievable. I'm not too sure we can hold fort for the government, but I am sure that at the Pharmacy and Poisons Board, there are several pharmacists who are involved in matters COVID-19. So we could also channel this question to the National COVID Task Force. Silas Ogutu asks, can there exist an exhaustive exclusion criterion for the COVID vaccine? So probably the question is, what is the exclusion criterion for COVID vaccines? Dr. Ohas, are you aware?
So far, there is no clear exclusion criteria, just that this is being done with a bit of care in pregnant and lactating mothers. But then if the risk, then of course, then you need to consider the risk. If the good outweighs the risk, then of course you give the vaccine. And it's too early as well, because then this vaccine, the vaccination has just begun. So we can't say much because we don't have data. Because everyone is at risk of getting COVID-19. So it's a bit difficult to say that you are completely excluded. But so far in pregnancy and possibly lactating mothers, but I stand to be corrected. But basically in pregnancy, when the risk, when the good outweighs the risk, then you actually go ahead and give it. Though Daktari, you would be in a better position to to explain that maybe. But as I've said, it's a bit too early because the vaccine has just been rolled out. We don't have much information concerning, when you shouldn't completely give the vaccine.
Okay. Lynette Mokaya asks, how true that it contains a chip? Simon, you would take that in terms of information from healthcare workers as ambassadors?
Yes, Doc, I want to say that it's a vaccine like any other vaccine, doesn't contain any chip.
Isaac Chirchir asks, will it be a single jab for a lifetime? That's a very important question.
I'll try and answer that. This vaccine is being given in 2 doses. You get the first dose, then 8 weeks later, and second dose is given. So far, we don't even know how long the immunity will last, because again, it's a new vaccine. It is subject to now us seeing how things pan out, and then now see how we will continue. Because as of now, no one can tell you that the immunity will last this long. So I don't think the one jab for a lifetime applies, because already you're getting 2 jabs in a span of 2 months. And then now with that, from data, now we will learn now how long the immunity is conferred.
Okay. Then Susan Kamau asks, what happens to the pregnant women who are in clinical practice, and what is the age range is considered minor in this case? I suppose the manufacturers of the vaccine have said that pregnant women are an exclusion. The reason pregnancy is excluded in any drug or vaccine is because it has not been tested in pregnant women and the effects are unknown. Minors, I think, is below 18 years of age. An anonymous attendee asks, why was Ivamectin not adopted as a treatment? I have seen studies that have been done on Ivamectin, and the COVID treatments are still ongoing, and evidence-based medicine, I suspect they have the studies are still ongoing, and that's, some have said Ivamectin, others not. So these are ongoing studies because COVID is a new disease. Mose asks, reluctant to take the vaccine, relies on information about the vaccine. How can people get the true information concerning the vaccine, as most sources in the internet are not true? Simon Gidui, you can take that.
Yes, thank you. I think when, as healthcare workers, first of all, we need to have the right information, because like we said, we are a focal point when it comes to acceptability of this vaccine, and even as a trusted source of information. Okay? And so therefore, we need to encourage all of us to only get information from the right sources. Okay, like I've already alluded in my presentation, that those who got information from social media, bloggers, and all that were less likely to take up the vaccine. The reason being, most of those bloggers and social media, most of them might not be actually giving the correct information. So we need to agree as healthcare workers, we need to get the right information from the right sources. For example, in this case, we are guided by the Ministry of Health. Of course, the National COVID-19 Vaccine Deployment Task Force is doing that as well, and sensitizing and communicating, and probably we should only rely on information that is credible and not any other source of information.
An anonymous attendee asks, on COVID-19 vaccination, would it be a baseline to immunize only COVID-19 test negative target population?
Can I answer that, Dr.
Yes, please do.
As I had earlier mentioned, we do not know how long the conferred immunity takes after you have suffered from the illness. So having suffered from the illness before is not a contraindication for you not to be immunized. Actually, unless you are actively unwell at that time and seriously unwell, then you're given time for you to heal, and then you can actually get immunized. So just the way we are not sure how long your immunity will be conferred, we also don't know how long the immunity is conferred after you have suffered the illness. So suffering the illness does not exclude you from getting the vaccine.
I suppose that has answered Moody or Mulako's question. If someone is sick with COVID-19, can he or she get the vaccine? I suppose that answer is a no. They cannot get the vaccine.
So once they're well, they get the vaccine.
Okay.
Yes.
His question was specific if someone is sick. So if someone is sick, I don't think you immunize them at that time. Kizito Lubano asks, what is the likely impact of rollout of COVID vaccine on the health systems already struggling to deal with prevalent problems. Simon, are you there? Or who wants to take that question on the impact of COVID vaccine on an already struggling health system?
I think I'll take that, Dr. Kigondu. Looking at the benefits of vaccination, reducing the disease burden, this will in turn reduce the impact on the healthcare system. So for us, having vaccination ongoing is a plus. And remember, we have an existing structure in terms of vaccination, unlike in some countries where vaccination is not really a big priority. We've had infectious diseases, we've had vaccination ongoing even in the childhood programs. So adding in an extra vaccine does not really weigh the system that much. But in the plus side, it benefits the healthcare system in that the disease burden will be reduced and thus will be able to function much better, because the impact COVID has had on us in the last year is something we really want to get rid of. Thanks, Kigondu.
Dr. Kigondu, if I would add on that.
Yes.
Thanks. I think for some of us who attended last week's presentation from the Minister of Health, the National COVID-19 Vaccine Deployment Task Force, Willis Akwela was presenting, and he did say that they have a budget, they have a plan, they have set structures to actually roll out the vaccine. Yes, we all understand we have challenges in our healthcare system, but yes, I think they're doing a great job about that. And he even mentioned how much money has been allocated for this particular endeavor. Thank you.
Thank you. Kasi Peter is asking, what has been the prevalence of side effects of COVID vaccine, especially the AstraZeneca one? Does anyone? Okay. I suppose we can look that up. If someone can get that quickly, then we can take it. What will happen if you get the vaccine at the time you are infected with COVID-19 unknowingly? Josephine Ohas.
What will happen if you get the vaccine and the time you're infected? So which means you're not symptomatic, right?
Yes.
Because what just like any other vaccine, we would not want you getting a vaccine when you're severely ill. But I don't think if you are asymptomatic, there's anything to it, honestly. But that's just my view, which stands to be corrected as well. We can confirm some of these concerns and then communicate during our next webinar.
I think part of what I've seen in other countries where vaccination is ongoing, testing is one key thing that has been happening. And yes, it's a debate. I remember during the last presentation that was done by the national government, they said they are looking into whether PCR testing, routine PCR testing for all those who are being vaccinated will be feasible and viable. But just as Dr. Ohas has said, if you're asymptomatic, the benefit of getting vaccinated are high because you will be able to boost your immunity using also the vaccine. So basically, I believe those who are asymptomatic, and when the rollout does happen, they'll be able to address those issues in terms of those who are asymptomatic.
And maybe just to mention that as it currently stands, as the first phase is being rolled out, and that is for healthcare workers, the disciplined forces, and teachers, what is basically being done is just screening. We are screening, you're being screened when you come to a facility that is immunizing, you're just being screened for symptoms or respiratory symptoms. Because again, we know that our testing capacity is actually very low. So when you're going to that facility, you sort of need to know that what will be done to you is screening, and then the first dose will be administered, and then two months later or 8 weeks later, the same will happen. The screening again will be done, and then the second dose will be administered.
Samuel Jenga asks, is the vaccine safe for elderly above 65?
The vaccine is safe for the elderly, just that because we are a resource-constrained country, we have had to phase this vaccination into 3. So number 1, as I've mentioned, phase 1 is healthcare workers, the forces, the discipline forces, and the teachers. And then the second phase is for people with comorbidities, which again, most of our elderly could be under that population. And then there's a third phase, and mainly that is people who are in, would you say, concentration populations? That's our prisons, slums, I think. No, I think it's prisons, and then people in the hospitality area. So basically, it's they have prioritized depending on the risk. These ones who offer essential services are more at risk because then they meet patients, or they're at risk of meeting these people more frequently. And then now those who are unwell or those who have comorbidities, the elderly, and of course the young who still have comorbidities will be in the second phase. So yeah, 65 and above can get if they have comorbidities.
So there is an anonymous attendee who is still on the Ivamectin protocol, and that can be shared by some South American doctors. So we can look that up. Okwani Jared asks, if the school-going children haven't been tested positive for the infection, it has been months since they got to school. What is the real pressure to have this vaccine rolled out when we have a population that has showed resistance?
Come again, Dr.
So Okwani says that if the school-going children haven't been tested positive for the infection, it's been months since they got to school. What is the real pressure to have this vaccine rolled out when we have a population that has showed resistance?
The pressure is on the teachers, because we have seen head teachers die. You have actually, and we've seen head teachers die. We've seen our Kawaida teachers die, because again, they are that risk population. So it's teachers who are being vaccinated, because we have been shown that these young people are able to tolerate this virus better than their teachers who are slightly older or those who then have comorbidities. So it's the teachers who are being vaccinated, not the students, because the students are most probably the teachers come into contact with this virus from the students who are mostly asymptomatic and are able to tolerate the symptoms or the virus well.
Okay. Francis Wanyama asks, what is the motive behind signing consent before being vaccinated, yet other existing vaccines such doesn't happen?
Are you signing consent or giving consent? And basically, you're just being asked, would you, the vaccine is recommended to you and you have a right to say yes or no. I stand corrected, but I don't think someone is signing anywhere. You're basically giving verbal consent.
All right. So Miriam Simiu is asking what the side effects of the vaccine are.
So, Dr. Kigondo, probably to mention those that have been listed by the Ministry of Health would include fever, headache, muscle pain, and pain at the injection site, among others such as allergies, especially for people who have allergies to the various components that are actually used as a base for the vaccine, including some people who have actually gotten anaphylaxis due to allergies within the component of the vaccine.
Thank you very much, Dr. Elizabeth Gitau. So it's similar to the side effects normally witnessed by other vaccines, pain on injection site. Okay. I'm not seeing any other questions. Let me look at the chat. The questions are finished. Again, the same ones are how effective. Yes.
Probably to add, what I've been able to see from the chat box is a lot of anxiety among healthcare workers and possibly fears among because of the various maybe rumors that have been had regarding the vaccine. So maybe to emphasize what we know, and this is basically on scientific data alone, is that the AstraZeneca vaccine is effective against the COVID-19, and what it does is prevents severe illness or symptomatic COVID-19 infection, and it is actually safe. We haven't had any adverse effects. And when you look at the vaccine development protocol, is that we've gone through various phases, and for us to reach phase 3, we haven't gotten any side event that would actually consider stoppage of the trial. So as it is right now, somebody has asked there why we are doing this yet we don't know for how long. It is because there pretty much the benefit of this vaccine outweighs the risk involved with getting the vaccine. So you are better off receiving the vaccine as a healthcare worker to avoid severe disease. Thank you.
Okay, I think with that, we have exhausted a lot of the questions, and I would welcome anyone with closing remarks to close for us. Kwoba? Okay. I think with that, we want to bring this session to an end. And from the beginning, we have seen that if the vaccine is brought today, 50% of those who have attended this webinar would take the vaccine. And we have seen that 21% would not take the vaccine, and that 33% are not sure whether they will take the vaccine or not. With what Simon Gidui presented, I think we need to do several things. We've seen that religious leaders are influencers in uptake of vaccines. It thus behoves on the healthcare workers to engage their religious leaders in giving them evidence-based information for them to be able to pass this information to their flock to increase to reduce vaccine hesitancy. We have seen that healthcare workers are a trusted source for patients and public. We would thus urge the government to include healthcare workers and professional associations in the Kenya COVID vaccine dispatch team. Lack of involvement of healthcare workers may be a hindrance to uptake of vaccines as a result of that. We also have seen that knowledge gaps among the healthcare workers may prevent vaccine uptake, and thus the professional associations are encouraged to take up trainings of their healthcare workers, and in especially sessions like these, webinars and on-site trainings to reduce poor attitudes. We would also want concerns on safety addressed, concerns on safety, and this is part of pharmacovigilance, whereby those who receive the vaccines fill forms and monitor adverse side effects, and these form part of the evidence base. As a result of that, it is good that healthcare workers will be the first to be vaccinated because they are more likely to be informed about the vaccines, and they are more likely to feel adverse side effect forms in the pharmacovigilance monitoring of the same thing. We also need to disseminate the thinking that the vaccination is a political tool by getting the politicians involve healthcare workers in some of the decisions and dissemination of information. We want to thank Simon for giving us the Combi behavior model. I think we will try and use it in increasing vaccine uptake by people, and especially beginning with our healthcare workers. With that, I want to thank all the panelists, beginning with the presenter, Simon Githui, Dr. Elizabeth Gitau, the CEO of KMA, Dr. Josephine Ohas, who convenes these meetings, Dr. Joy Mugambi, Dr. Jacqueline Kitulu, Dr. Catherine Gitau, and Edith Koba, and all the associations that have been involved in providing this information. We will continue giving this information in our Tuesday webinars and also our Thursday 2 to 3 p.m. clinical COVID webinars. The National Nursing Association of Kenya is running the call center, and anyone who feels psychological drain can actually call the call center. With that, I want to bring this meeting to a close and thank all of you very much for attending this webinar. Your CPD points will be sent to the email address that you registered in, and if you have any feedback, you can give it through the Kenya Medical Association website. Recordings will be available on the YouTube page of Kenya Medical Association, and it's also streaming live on Facebook. With that, I want to bring this meeting to a close. Thank you very much to everyone.
Thank you.